tonight to talk about the brain and spinal cord complications. When I started getting a lot worse in November 2021, I saw a different neurologist because my normal lady was all booked up, and I told her about some of the things that were concerning more recently. I started like a positional tremor, started having like severe brain fog, like I'm on a train and then suddenly there's like a wall on the track, and wherever I was going I can't see anymore, and there's just like nothing. Word loss, like bench. The other day, Pringles were tube chips, which actually I prefer now. So tremor, word loss. I was no longer able to keep my balance. If I was trying to stand and put my shoes on, I had to sit to do that. And I realized every day I was dropping things, and that was new. I mean, I've always been a little klutzy, but it was just very prominent suddenly. And then in addition, my dysautonomia, blood pressure drops and heart rate increases had severely worsened, and I was having days where I was crawling around the house and multiple times staying on the floor because I'd black out. And so I saw a new neurologist, told her about all this. I was nervous about Parkinson's or MS. I don't know. She did say that she wanted to do an MRI of the brain and neck.
So in November 2021, I got an MRI of my neck and head. It came back reporting 5 millimeters of cerebellar tonsil herniation. I have straightening of my neck and some bulging discs that were putting pressure on the thecal sac, which is the part that surrounds your spinal cord. Since I already knew about Ehlers-Danlos syndrome, I knew what cerebellar tonsil herniation was.
Chiari's when the brain herniates through the hole in the skull that your spinal cord comes through. Mine was being reported as 5 millimeters, which meets the criteria for Chiari Malformation 1. And it was hard to parse through, could this dysautonomia be caused by this? Especially because I was having such bad cognitive things, I would maybe read, oh yes, definitely an association with dysautonomia, and then honestly forget about the next day. So I kept being sold on Chiari being the problem and then not sold, and I confused myself and everyone around me basically.
In her report of her exam of me, she said that, one of my pupils was still bigger than the other, and there was decreased sensation on one of the sides of my body. She took a pin and pricked me all over the place. I think it was about 2 weeks before that neurologist called me, and she said everything on my scans was mostly normal, and I was just speechless because I knew it wasn't. So this was November, and I had become so much worse after doing physical therapy and just started to realize what CFS was. My myelocephalic encephalomyelitis. I don't know. It's stupid when you can't say a disease name that is ruining your life.
Myalgic encephalomyelitis.
CFS is chronic fatigue syndrome, but that name in itself led me to not realized that I had it, because I had always been like tired. I'm a mom. I work full time. My kids have extracurriculars, baseball, t-ball, swim lessons, physical therapy, occupational therapy, so I was tired, always tired. There have been many people now that have had their ME/CFS go into remission by treating the brain and spine abnormalities. So that gives me a lot of hope, but at the same time, there are people that it did not work for. So I have been spending a lot of time trying to learn as much as I can about these conditions and determine if that's something I want to do. So that neurologist didn't tell me anything about the Chiari. I joined a Facebook group, just like I've done with every other illness, and they, gave me the rundown, what I need to do, what other people have done to get a consult to figure out if it's the cause of your issues. I have headaches, but they're hormonal. They are excruciating, and they're 3 days long. And I've considered going to the emergency room for them. They started with COVID. I don't have everyday headache. I have everyday head pressure, which maybe some people would call a headache. I'm so literal that it has been a disservice to me. So the symptoms that are Chiari, I believe, is my ear ringing, which gets really, really loud. If I'm upright for too long, I can start to experience the typical Chiari headache in the back of my head, but I haven't had that in a while because I haven't been upright that long, because other symptoms will make me lay down before then. So I saw a neurosurgeon locally that wanted to run some more tests. He ordered what's called a sine flow, which is, again, just another MRI, but with a pulse ox looking thing on your finger. And it shows the spinal fluid going into your brain and where it's flowing and how it's flowing and if it's flowing. He also ordered neck x-rays and flexation and extension, which means bending forward and bending backward, to check for obvious cranial cervical instability. With people with Ehlers-Danlos syndrome, can't usually see it on an x-ray. It's usually more an MRI, and there's specific measurements to see if the instability is far enough out of range that it could be putting more pressure on the brainstem. He also ordered neurocognitive testing with a neuropsychologist, and then finally met with him again. That appointment was very disappointing. He had made it clear that he was working me up for brain surgery on my first appointment with him, seeing if brain surgery would help me because I was sick and had some of the typical Chiari symptoms, some of the not so typical Chiari symptoms. So he ordered those tests to see if he was going to offer brain surgery, Chiari decompression surgery to me, or recommend it, or, have to have it, because if your fluid's blocked, you have to have it. I think. Maybe you don't. If your fluid's blocked, it seems like you have it. I don't know. Something that struck me poorly about his workup was it did not include a full spine MRI, which is important because a lot of people with Chiari Malformation develop what's called a syrinx. I think I'm saying that right. It's a bubble in the spine full of spinal fluid, and that can paralyze you. So it's really important that you find that if you have one. Again, very prevalent that people with Chiari have one, because if the Chiari is blocking the flow of your spinal fluid from coming into the brain and then out over your spinal cord, then if the Chiari is blocking it, it tries to force a new path, and it can get pushed inside of the spinal cord itself and create that bubble. I don't know if it's actually a bubble, but it looks like a bubble on the imaging. So it struck me wrong that he did not order a spine MRI to make sure that I didn't have a syrinx, because that should be a big factor in also determining whether I need the surgery or not. Another thing I didn't like is a lot of people with Chiari also have either tethered cord. A tethered cord is when the spinal cord attaches lower on the spine and then is pulling really tight on your brain. So if you don't take care of that first, you could have an unsuccessful Chiari surgery because you're just going to pull your brain back down. And then another thing is if you have high pressure, if you have intracranial hypertension, IIH, that's high pressure in the brain, and that could also make the Chiari surgery less successful if you don't find the cause of that high pressure and the cause wasn't the Chiari. Then again, it's going to push the Chiari down. And then there's also intracranial hypotension, which is low pressure in the brain, which is typically caused from like a spinal leak, which could be from like a lumbar puncture or epidural or an accident. But if you have Ehlers-Danlos syndrome, then, we have floppy, loose, fragile tissue, and we are predisposed to spontaneous fluid leaks. So we could be leaking fluid, and therefore the fluid pulls the brain down and into the Chiari. Typically those aren't as big, but it happens. The first neurosurgeon did not look at my scans with me. He walked in and said, "Good news, no surgery." And I had been in his office for like 5 hours, which was a big deal for me. I had been being pushed around in a wheelchair by the staff and laid down for all of my neurocognitive testing, and was laying on the table whenever he came in there. So him coming in saying, "Good news, no surgery." Yeah, that is good news. I don't want brain surgery, but it felt like just very mixed emotions. He told me I have evidence of high pressure with the empty sella syndrome and referred me to a neuro-ophthalmologist, which makes sense. My pituitary gland is flattened. I need to get a better image of just the pituitary gland that my endocrinologist ordered, but I haven't been well enough to do that yet. My 3 brain MRIs that I've had since, it shows the pituitary gland is empty. You can see that it's full of spinal fluid. My endocrinologist tested like basic hormones again after we found that. He also referred me to a migraine clinic or a headache center or whatever. So I was pretty hysterical because it had been, like 4 months or something of, am I going to have brain surgery? And then feeling completely invalidated and not seen, and it was bad. So I started working on a second opinion from another neurosurgeon, which people say in this situation you should have, at least 3 opinions, because this is brain surgery. These brain, neck, spine problems in people with Ehlers-Danlos and or people with ME/CFS are very complex, and there's not a lot of doctors that fully understand the big picture and are thorough and check for all the things and make sure that you have the information you need to move forward. We also have such limited capacity for activity that getting these tests done, if we're even able to at all, take months and months. A lot of us have MCAS, MCAS, mast cell activation syndrome. So we have to pre-medicate if we're going to get any contrast IV with the imaging.
I was telling you before, there are 3 mechanisms of action of the tonsil herniation. One is creating an obstacle to cerebrospinal fluid circulation. Your CSF flow is not entirely blocked posteriorly because there is a little stream passing by, managing to sneak by. Right. That's why your symptoms are not entirely typical. Right. The second thing is there is a mass effect, and at that point, the more fat the tonsils are, the more are nudging and elbowing the brainstem. Right. Then there is a third effect, which is called neurovascular compression, which is a little bit more complex, but you don't have it. Okay. When the tonsils are so low, and they're so fat and they're so stuck, even if you removed the cause of the problem, the tonsils will not go up. They're already giving you the symptoms, which are listed in the page from 1 to 4, which is called the cervicomedullary syndrome, which is region related. It's not pathology related. Yeah. So everything, for example, you have a broken foot or a cancer in the foot, you can have a problem in the foot. Right. Okay? Obviously, that is simple to understand. The cables and the nerves passing in that area of the craniocervical junction is a little bit more complicated, but it's the same principle. Okay. So it appears that the tonsils are creating part of the ruckus. Right. And also they are in the way for us to further understand your case. Yeah. So get it out, process of simplification. We set our expectations to, they're not going to be a miracle solving the problem. You're going to be married Prince Charming, you're going to be in a castle and blah, blah, blah. Yeah, but we're going to have a limited expectation, which means it's going to help for some of your problems and is going to make do a step forward diagnostically, because we're going to have one less thing to worry about. Okay? Yeah, right. That is one. Yeah. Because that's unfortunately is what you have to do in the cases which are off the beaten path. Yep. For example, because at that point with the tonsils out of the way, if you're going to have an intracranial hypotension and we put the probe in the head, without the obstacle of the tonsils inside the skull, we're going to be able to better grade your intracranial hypotension. We're going to chase it, etc.
Join me for a spot of tea. Just Just kidding. This is coffee and it's my second cup. Woo! Just kidding. So it's been a week since I talked to Doc about my Chiari, my herniated cerebellar tonsils in my brain, not to be confused with the tonsils in my throat, which are fine as far as I'm aware. I should probably knock on everything. When I first heard about like Chiari surgery and what it entails, you know, breaking a part of the skull, making a hole in the skull, and going through the dura and exposing the brain, and I've been sitting with it now for 9 months or something, and I feel better about it. When I watch surgeries, because he speaks at conferences and talks about his technique and what he does differently and all that fun stuff, I no longer want to vomit. He makes it look so easy that, and he does it all the time, and you know, he has a like really good track record apparently, which I'd like to find stats, but he makes it look so easy that I get nervous that I'm torturing myself by not doing it. But then I still have the fear of, that's a huge surgery. Like, I have to bring myself back to reality. Like, that is a huge surgery. It's a serious surgery. It's one that you don't want to have to do more than once, because the probability of success will go down each time. So the plan is a good plan, that we will get more testing and look into a few other things and reevaluate. If we could prove that, for example, when I'm setting up, the Chiari is blocking the flow, or maybe even pushing on one of those blood vessel or something. If we could prove why I feel this way when I'm sitting up, I would be much more, I mean, I'd have to have the surgery. I would have to, because this is my biggest problem. So
A few weeks later, I got results from the infectious disease doctor. I had an ongoing EBV infection, Epstein-Barr virus, also known as mono. Reactivation of EBV has commonly been found in people with long COVID, and before that, people with ME/CFS, so this wasn't very surprising. Also, my cytokine levels came back high, which meant inflammation, another common finding in ME/CFS and long COVID. I put the brain testing stuff on hold, started an antiviral, as well as working to get the inflammation down. Unfortunately, in early November, I caught the flu. My son had to get a test because his fever was so high and had to go to urgent care. I wasn't that sick with it. It was more like a cold, but I believe it's now February 3rd, 2023, and I once again declined in November, and I'm on 12 weeks of really being in rough shape, not really able to go do any of the testing not even some of the blood work that I need to do. So I'm just kind of waiting to get better so that I can make some educated decisions, hopefully. Or, spontaneous recovery is welcome as well.